Okay, great.
So just for the record, there are no changes to the meeting minutes.
Yeah, great. And it looks like we have 7 folks, including Tara and I, on the line. So thanks for those who could join. I think we had a good discussion last time. It just with all things autism, it's not, it's really where to start and how to narrow the work list and the priorities so that we can try to get something accomplished, because we could list issues repeatedly every meeting. But so I think one of the things that's on the agenda is just to talk about the goals of the group and the priorities. So in the meeting minutes, there is what we talked about for the 2 goals of the group. Everybody have a chance to look at that? Does anybody, do we feel that those are reflective of the group that at least is participating today? We talked about gaps, so where we would focus our energy based on those gaps. It's number 2 in the committee goals.
So Lynn, and I wasn't here last time, when you say number 1, funding for programs, what programs are you talking about? Like general programs?
Training programs.
Training programs.
That's what we were focused on. Yeah. Training and education programs, really just to be able to improve access to service, I think, is probably simply said. Does anybody hear that differently? Okay. So, so what we talked about last time was that all of us obviously sort of represent a different segment of the autism community, in terms of the services, either the people we serve or the experience we have. And so what we talked about is really each of us coming forward with our own view of, where the needs are, and creating, sort of a data dump of that. And then the next step in that would be to look at, okay, here's all the needs, but where are the biggest gaps, and where do we want to kind of focus the effort of this group? Because I think ultimately what we want to do is be able to make recommendations about what training and education do we want to support as a council, and either support to develop, inform the development of, and that's why we had asked for, I know that Carillon data was shared in the link, so we could look at some of that and, try to use that to help us identify where are they seeing gaps in terms of being able to help individuals and their families access services. So that's, I think, a jumping off point, unless somebody feels differently. Any thoughts from the group on that? No. I mean, I'm happy to start and, just sort of talk about from our lens as a provider of inpatient, outpatient, partial hospital services. One of the things that we've really worked hard to do is to try to partner with organizations. Interesting. I had a call today with Hartford's mayor's office, really talking about one of the things we find, for example, just to talk about partnership, is one of the things we find is that there are limitations to accessing services, even when we accept the insurance, because we accept all insurance, and as long as they accept us. But we accept the insurance where we have the expertise to provide the service. So for example, our partial hospital program, the challenge there is the parents have to drive the kids to access our services, right? So unless the school system agrees to do that, you have a transportation access. So what we talked about today and looking at partnerships is how do we help build the resources within the school system so kids actually can stay in their school district and not have to go out of district, not even to come to a partial hospital program. Where are their gaps in what they know in a professional setting to be able to keep kids in the school district and not have them have to come to another placement. So that's just one of the things we talked about. So it might be, that's a broad category of maybe helping to enhance the skill set of educationally based professionals in school systems to be able to better support kids, in place. That was one area. The other area gap that we've identified is obviously like Caroline, when we go to discharge kids from our highest level of care, if there aren't services in their home, ABA services, a chance of that discharge being successful, or the gains that were made in a very acute inpatient stay being sustainable are going to drop significantly. So increasing the training and just of folks who are out in the community and willing to provide that level of skill set. And then, we could go on and really go deep into a clinical setting, which is, I don't think really we're focusing. But for example, we do a training academy for nurses' aides because we couldn't find our own. So we said, we'll train our own. So it's at no cost. It's something we're doing to try to build a workforce pipeline by training our own CNAs. And we've had conversations around, do we start a training academy, for individuals who want to work with children with autism and behavioral issues. So those are just some gaps and some ideas that we've had just from my perspective. But again, I represent just one view of the community and the continuum. So anybody else willing to jump in and share?
Well, I know, Lynn, and two of the school districts that I work in, they do partner with outside mental health agencies. And
Yep.
so the staff come in from, for example, River Valley comes into East Long Meadow Public Schools, and they have a licensed clinician that's 1 day a week in that, and it's billed through the child's private insurance. So it's the only issue for staff, for the district, was to find a place for them to go, but they actually provide all the extra support and stuff for the staff as well. So I think that's a great place to start. It's been very successful in a couple districts I know of.
And that is not only for, because we've heard that, we've actually talked to some school districts who have what you're describing, and I'm sure it varies by the provider. Some providers have more or less expertise with autism, so they do really well with sort of the general child who needs that level of support, but maybe not as well with, so maybe just upping their skill set to be able to handle more challenging situations involving autism. Is that a fair assessment?
Yeah. Yep.
Okay.
I'm wondering too, in terms of creating that pipeline and access between like what you were talking about with schools and hospital or outpatient or outplacement for programs like the ones that I'm connected with, and in-home services. If we could talk a lot more around the education that goes on between all those providers and how they work on their communication skills and the ability to keep that united front in that flow going. And I don't know the scope of this work, if this could also be a part of it, and that is access to private pay supports and insurances to cover those in-home, and where the pay and support for that could come from a school system, and some that could come from insurance. I'm, as a mother, running into issues where Connecticut has a law that caps in-home services at age 21. And so if we could look into that cap being removed so that we can expand our services at least till age 22 as school age, but preferably into adulthood, which would certainly impact the autism waiver and the ability to provide more access to individuals.
Kim, I think you touch on it. We would all, I think, agree on the gap that, that after 21 or 22 period, that young adult who really has had support and made gains. And then now how do we continue that so that they don't end up needing a higher level of support or care at some point? So I think that, I don't know that anybody would disagree that that's a significant gap.
Carrie, you had your hand raised.
Oh, I'm sorry. Maybe I gotta change my view here so I can see.
No.
Okay. All right, Carrie, please.
Oh, I can't hear you.
How about now?
Yep,
Yep.
that's better. Thank you.
So again, I wasn't here last time, so I apologize if I am saying something that's already been said, but it seems to me that everything that has been discussed here really kind of what precedes all of that is the fact that we don't have enough people entering the field or remaining in the fields, right, that serve our population. So whether we're talking about education, we have plenty of, if you kind of dig into the state website, and Brian could probably speak more to this, we have a good number of certified teachers. They're just not working in schools. So where there might be a desire to train people in place, there aren't enough people in place, whether we're talking about schools or in clinical practice. We don't have enough psychologists. We don't have enough counselors. We don't have enough support. We have a lot of ABA stuff going on now. But that doesn't serve all of our people in a comprehensive way. So I think the bigger question for me is, how do we recruit and retain people to serve our folks in these various fields? So we can train those that are there, but again, in some cases, we are asking them to do more with less. And that's overburdening people. And that, I think, is what's driving the exodus from various fields, like education, where we are not retaining people. So I think that's a really critical question. From where I sit, I think that's a critical question for us to grapple with as sort of this think tank. How can we not just how can we improve circumstances and services for this population, but how can we draw people into these fields and keep them there? And that's a really big question, I know, but a really big lift. A critical one, I think, if we're drawing this out over the course of time. So.
Yeah, I mean, we certainly see that, but I have to say, that in our behavioral areas, we have a better retention rate than in our medical areas, and I'm not sure why that is, because I don't think that the work is easier. So I think this is one of those opportunities where I don't know, and please others speak up with a different opinion, so if we're focused on education and training, I think, is that the focus of this group? And do we partner with somebody who's focused on sort of that? This is workforce development, but I think the retention piece, I hate to say it, but at the end of the day, it comes down to, caseload and pay, right? And I think so the provider has to be paid an adequate rate in order to pay their staff an adequate rate that is enough to enhance it, right? And so we see sometimes people coming from organizations that are less resourced than we are, and remembering that we're largely Medicaid, 85%. And so how do you do that? But I think that training piece is important, because if staff feel appropriately trained and supported, we find, like when we survey our staff regularly, what they ask for is oftentimes more training. And so if they feel better able to handle the challenges of their caseload or the, circumstances that they're dealing with, it might negate some of the inability to compensate people higher, because it's just more challenging for people to work in health and human services because of pay rates. But Carol, you have your hand up.
Yeah, I just wanted to, I wasn't here last time either, so I also don't want to make things confused. But when Carrie brought this up, I feel like I'm channeling Yana a little bit,
Yeah.
because there's a lot of difference between services for adults and services for children, right? And so services for children, the schools are responsible for that, and the problem is that all schools are not equal, right? But there supposedly is some support being given to them. And then when we shift to the adult after they're 22, if they are, have that IQ above 70, and they're just on the waiver and they get nothing. And so I feel like there's maybe having discussions about children versus adults might make some sense, because if we just focus on children, then we lose kind of like this huge amount of people that are getting nothing.
Yeah,
I'm not trying to shift the focus to children. I'm just citing that as an
Oh, no,
example.
no, no, I just wanted to make,
And, right, no, but I will tell you too, that our autism center here at Southern, Fred Volkmar put together a package for like $45, right, to train individuals working with adults with autism. Not one person has signed up for it yet.
Is that
Now,
right?
that could be because maybe it's not out in the right spaces. I don't know, but it's not gonna run, like, we can't get people to come. It's not, unfortunately, it's like, it's not if you build it, they will come. Like, it's not, they're not coming. So I don't know what that's about, but we definitely don't have enough people. I fear that it's about, we don't have enough service providers in the community either. And therefore they are already they're taxed, right? They're overtaxed, and they probably can't find the time to um to sort of sit through an additional training, because they're just trying to keep all the balls in the air. I don't know. I'm speculating. But
Hmm.
Carrie,
Interesting.
can you share that? Because I don't know anything about that.
yeah, absolutely. I will. I'll get it for you right
Yeah,
now.
that would be great.
I can just say one other thing, because I can talk a lot, but so in terms of the age 22 cutoff, I do believe, and maybe Patrick can chime in on this a little bit because he probably has this information as well. The reason for the insurance-based payment for children, for people under 22, is really based on that old Lovas research that says that, and the old Lovas research was done on children. And so they're only saying that that adults with autism don't benefit from that level of training. And it's because there was no research done on it. So the insurance companies, and they'll say that to you if you talk to an insurance company, that there is no research saying that adults can learn, which is horrible. And it's all based on the old Lovas stuff.
Hi,
I
I
don't know.
apologize, everybody. I don't know if you can hear me or not, but my
Yes. Yeah.
internet has been horrible today. I'm not sure, just in the last half an hour. I mean, you're right. The research in the ABA is based on the old Lovas research, but I mean, there is research that suggests that adults with autism can learn. So that's kind of, I think, silly that the insurance companies say that. There's just not a ton. There's just not as much research with adults as there is with children.
Well, and the insurance companies are going to find any reason they can to deny the services because they
Hello?
don't want to pay it. So I guess that's
Hello?
another thing to kind of maybe tackle at some point.
Well, I think we should always be thinking about what especially this is going to be a long session. Medicaid's on the ticket as always, and I think we have to think about. My belief is always that, and not that we've ever done this, but asking for everything often gets you nothing. And I think so we have to think about prioritizing what our legislative asks are, and maybe what our focus is. When we are talking to legislators about some of the priorities, and we hear all the time from families, the same thing that all of you do, and what we hear from Yana, and it's true. I mean, as much as there is for kids, there is just very, very little, and for those really I don't want to say unfortunate, but those individuals who are in an unfortunate spot of being, having the IQ over 70, but still very impacted, and their functioning is very impacted. Do we begin to, as a group, sort of hone in on what's going to be our focus, right? Because I think, again, if we try to focus too broadly, we kind of dilute our message. And I think we have to think about that. And, we can talk about whether in this group, what we're focusing on in terms of training may be more directed at adults. I mean, that's a discussion, I think, that this group could bring back to the broader group, because we do oftentimes go down rabbit holes. And then I think the challenge with doing that is then we begin to debate each other when we're all really rowing in the same direction and trying to accomplish something, but we end up kind of cycling and, you know, circling the drain around the various challenges, so.
I agree that prioritizing, it's not to say that other things aren't, it's all important, right?
Right, exactly.
Yeah, but I agree that if we prioritize a focus and create a long-term plan rather than, you know, to get those short-term gains, rather than trying to focus on everything, I think would get us further. And I do agree with Carol that I think our biggest hurdle is that population that doesn't receive those services that really make or break the difference, right? So post 22 educational experiences, not eligible for DDS, that's the population that I personally worry about, both professionally and certainly within the parent network, because that's the population that has the biggest need at the moment.
Other thoughts? Tara, when's our next council meeting? Sorry, I just don't have it in my brain.
You're fine. It's in September.
Okay.
Hold on, I want to say, I don't want to misspeak. September 18th.
Okay. So that will be before our next meeting, right?
Correct.
So I think this will inspire a lively discussion because there's a lot of passion around. I think, you know, looking at the age continuum and really identifying where the gaps are. So any other?
Just to draw people's attention, I put into the chat the link to register for the adults with autism training, and the dates are October through February.
Thank you very much.
Yeah, thank you. Yeah. I'll certainly share that. I just anecdotally, and we do have, it's interesting, because we provide training, for example, the Nurses Aid Academy, you know, we do end up getting people who are maybe underemployed. They just haven't had the opportunity to access education. So we have some great, you know, we love telling the success stories about the person who starts out as a food service worker, you know, in our kitchen, is really inspired by the work that's done in the hospital, becomes a nurse's aide, goes on and taps into the tuition reimbursement program, becomes a nurse. I mean, there's some great stories like that. And I have heard, you know, we require, obviously, a certain level of education and a certain level of experience to work with both our children with autism, but also we have adults with brain injuries, right? And something like this, I could see people wanting, I don't know, does it, you know, what is the fundamental, like what's the baseline academic presentation you have to have? But I could see something like that, because that's where you're getting people who they will do this work because it is an enhancement to their current, you know, earning level, and they feel like they're making a difference. So I think in a lot of our settings, you can inspire people who see the work that's being done, and encourage them to, you know, do more.
I love hearing stories like that. And it, I think that's the sort of like innovative thinking, right? Is looking for those non-traditional students, if you will,
Yeah,
or
absolutely.
folks that come. We, you know, similarly, and of course I kind of default, I live in the College of Education. So I kind of default to this, but similarly, you know, in trying to facilitate, assist, grow the teacher population within New Haven Public Schools, it meant going into New Haven Public Schools and partnering with them. And this is, you know, speaks to the power of partnership too, drawing upon paraeducators who do the work every day with students with, you know, varying needs, and creating pathways for them to become certified teachers. I mean, some of these folks, to your point, have been dedicated members of that community doing the work for there's a woman who's in the program who's been there for in excess of 2 decades, and now she's going to be a certified teacher and be able to, so it's finding ways to support people who might not otherwise have access, but have the desire and, are committed to the work. And I love the idea of finding people from within various organizations or who are affiliated with such, like what you just described, and supporting them to find their pathways. So I think that's really critical to enhancing our workforce.
And there are a number of healthcare academies that have popped up in high schools across our state. We were us and the hospital, the community hospital in town, probably 15 years ago, we did a startup and helped to fund the healthcare academy in New Britain High School. And we hire, and train a lot of folks who are sometimes the first people in their family to actually have employment or to, get a college education. And I think tapping into that workforce, not just the existing workforce, and you have to invest a lot. Obviously, they're coming to you. In many cases, this is their first job ever. So they're not going to walk in and work on our autism unit, but they can walk in and be a patient support aide, right? And begin to grow like that. But that's tapping into, going out and reaching out into the schools and partnering with them, doing summer interns and all of that. It has been very successful. There's a model to do that. You don't have to start them up. They're out there and existing. So I think, and I want to refer back to Capital Workforce Partners, because I think, we, at least for us, this is not the work we do. But we have, we have to do it, but there are people who there's, grants to support it. There's a lot out there. There are people who are doing this work that we could partner with and say, this is a need we have, and how do we connect the work they're doing with the need we have and be a conduit for that. Other thoughts on this?
I think it also highlights the difficulty for people who are doing the in-home supports, right? Because there's, whereas you have in an organization, you may have some opportunity for advancement and people are working and seeing that and what that job looks like. Whereas the in-home services and supports or some of the other clinical supports, students who are going into school may not have had those experiences, that they could draw on for, oh, this is something that looks like I would want to do. It's not until they're in college that they're, if they chose a, coursework in psychology or something like that, that they'd be looking for those internships and trying that out. So I wonder if there's a way that we could leverage, high schools and peer support and things like that, that would, maybe interest more people to go into the field.
Somebody better educate me on, when I was looking at the Carillon data, and you triggered that with the peer support. What peer specialist, can anybody actually describe to me what does that role do within Carillon? Does anybody know? I've heard it referenced. Like, is that somebody who works with parents? Is it a parent themselves? I think that might be a good question for us to pose. And is that a role that we can somehow think about incorporating as we're having these kinds of discussions?
So this is Krista from Department of Developmental Services. I can provide a really brief overview of what
Great.
peer support is under the DDS waivers.
Okay.
I will state a sort of a disclaimer that I'm not sure if it aligns with what peer support is under Carillon. I'm going to assume that it's similar, but just wanted to make note of that. I don't think we have anyone here from DSS or Carillon, so I would ask that we probably just confirm with them. But for DDS, we have peer support as a waivered service under our three DDS waivers. And really what that service does is it allows individuals with intellectual disability to connect with their peers and offer an opportunity to work through different goals. So, and there's also a level of advocacy that's associated with the peer support. So we talk about it as almost peer mentoring, an opportunity for individuals to meet with others, to talk about things and challenges they're experiencing and learn from another person who is in a place where they've advocated to reach their goals and to have their needs met. We've found the support to be incredibly helpful, but it is interestingly enough one of the supports that we always want to increase participation in. So we have self-advocate coordinators that are actually hired at DDS, and one of their main responsibilities is to really promote the importance of peer mentoring or peer support. I'm going to assume that Carillon sort of offers the same opportunity, but I do wonder if they experience the same challenges with participation as we do with DDS.
So thank you, Julie. She just posted in our chat. She found some information on that program. I know that's something Yana has expressed, has talked about a lot, and the value of that, not only to her, but how, she would love to do more in that area. So, Krista, what are some of the challenges that you find? Because I will look into that, but I'm assuming that it is probably similar. What are, in terms of engaging, getting people to actually do that work?
Yeah, there's a level of engagement that has to happen upon the initial sort of interest that we continue to have to work through. And I think our self-advocate coordinators that work at DDS have really tried to promote and offer the opportunity. I think, when we think about supports and services that are offered through a state agency, peer mentoring or peer support isn't one of those initial items. And, especially for DDS, we have a lot of legal guardians that really play a lead role in supports and services. From a legal guardian's perspective, peer mentoring may not be one of the most important opportunities that are offered through our waivers, right? They're looking at residential support. They're looking at employment and day support. So sometimes peer mentoring is really looked as almost like an ancillary service or support. So I think it's just, one of those services that we continually have to educate and we have to educate audiences about and make sure that we're promoting. And the self-advocate coordinators have been doing a wonderful job of that. The other thing that we need to make sure we have is we need to make sure that we have peer mentors. So for the DDS waivers, we actually have to qualify them, make sure that they are enrolling and want to be a peer mentor. So we struggle a little bit with that as well, trying to find individuals who want to play the mentoring role, for a potential mentee. So it is really, as I sometimes think it's sort of an educational and barrier, but we continue to promote it. I think maybe even engaging with Yana a little bit would be very helpful. Like you said, she's been incredibly supportive of this service and has really worked to try and expand it. I think, her experience, challenges, barriers, and things we can do to improve it would be really great to hear. Again, I'm not exactly sure if that's what Carillon is providing or is offering to individuals. So it would be something that we just probably want to take a look at. I'm assuming it's similar. I'm assuming the challenges are similar as well. But just wanted to note that cautionary item as well. Thank you.
Thanks, Chris.
Yeah, of course.
And Jennifer said she could be here for our September meeting from Carillon, so she can help explain some of this data and.
Okay. Yeah, great. Okay. So what are, so I think, we've come up with, a number of areas of opportunity, but in terms of, does the group feel that we should be focusing more on the adult population, if you will? Are we not ready to, or just maybe, noting that when we bring this back to the council to get feedback? Are there Is there a strong sentiment one way or the other?
I would think that training as a would be applicable to any age population. That the training piece is applicable to all that. I do think that giving more to just the young, and I know that nobody's saying this, giving more to just the young population and continuing to give nothing to the adults. I mean, I almost feel like it needs to be they need to be a little bit of a priority with the idea that training for everybody is important.
Mm-hmm.
And I don't know how to make that, I don't know how to maybe say that in a different way that makes more sense.
Well, maybe it's, I think when you look at, if we look across the age span and somewhere, I'm visualizing having seen this, all of it, when you look almost on a chart somewhere or graphs early on in the council where you're looking at what are the resources by age, right? And you just see that they sort of fade, right? As you go towards the, 22-year-old birthday. And so I think, and I'll do a little bit to see if I can resurrect that, but I think just pointing that out, sort of laying out, here are the services that we currently have here, where we see the gaps in service, and then identifying the gaps in service may be in large part due to the lack of workforce. So how do we support either the current workforce upping their skills or bringing new people into the workforce? Does that make sense?
Yes, I would. And just to kind of piggyback a little on what Carol said, even though I do agree there's broad training topics that will go across all age spans, I think there's nuances in that training and how we deliver those services and how we organize the thinking around those services absolutely has a developmental sequence to it. So I would I think we could create a plan that says, okay, here's the training topic. And here, maybe we could talk a little bit about how it might work with the developmental sequence of it. But I do think from just a practical experience of my own that is actually lacking as well, not just the services, but just the understanding of how there's a uniqueness to working with adults. And many providers, I don't know, I find it's harder to find providers that understand what it means to work with adults on the spectrum versus children. And so I think there does need to be attention paid to that.
Can I just say one more thing? Sorry, I can talk. So as we're talking though, what I'm, as a provider that works with people on the waiver, what's kind of become more and more apparent to me as we've been bringing these people off the waiver is that the guys that I'm getting now, the guys and ladies I'm getting now have been out of school for a decade or longer, and they've been sitting home. And those people, the educational system has provided a lot of support and a lot of training and a lot of education to this group of people. And then at 22, it all stops and they unlearn a lot of it. So by the time I get them when they're 35 or 30, all the skills that have been invested in them for so many years are really gone, and we're starting over. So I feel like when we talk about the education to, the job readiness and stuff like that, I would feel like, not that we want to ignore our 30 plus years old, but focusing on those people that have been in the school system all along, who really have been handed things and kind of carried through and pulled through the educational system. And that's my own personal opinion. That's not a bad thing at all. But I think people are that we try to get our people to graduate, we try to pull them through. And then at 22, boom, it stops and there's nothing else. And they don't have the initiative, the executive functioning skills to be able to independently kind of continue that momentum, if that makes sense. So those 22, 23-year-olds, when they graduate, they just fall apart. And then they stay falling apart until we pick them up on the waiver or somebody else, or something else happens for them. So there's like almost like there needs to be a bridge that needs to be gapped, to be past during the 22 to 25 to get people to be more independent, if that makes sense.
Absolutely.
I will capitalize on that too, Carol. Like I call it the cliff. There's this, there's a gradation, again, going back to that developmental appropriate approach, that doesn't happen as successfully as and it's a personal opinion, I'd like to see at that, when we start moving through those transitional ages at the school level into adulthood, because we aren't necessarily developing those executive functioning or those independent self-advocacy skills. A lot of times skills are still worked on towards those high school graduation focuses, and in some cases, maybe too much focus on compliance rather than developing that notion of, let's talk about how your problem solving skills go. Let's talk about how you made that decision and why. And thinking about like, as you put it so nicely, that momentum. So I would argue maybe the focus needs to be young teenagers into those adult years in order to prevent the scenario that Carol just nicely described.
What are your thoughts on next steps with this information that we've discussed today?
I think it highlights a couple things. One is that, there's still service gaps in what we're talking about, compared to also people who have the expertise to fulfill that need and provide those services and supports.
I think that kind of relates to something I was just thinking, which it feels like we're describing the service gap. And maybe that service gap is because people aren't trained to do that work, but what if it's that there aren't people doing that work or looking to hire people to do that work, right? And that's a different.
I think we're saying, Julie, it's really both, right?
Right.
And I think that's what, Carrie pointed out, is that even when training is provided,
People don't come.
Yeah, people don't
Right.
come. So I think that's why I think it's going to be, I think we have to decide as a group, if we're going to try to accomplish something, which we want to, right? We don't want to just meet and say what we all know, which is important. This is good information, is, if we're going to focus on, there is a desire, there's a group already, we just need to enhance their skills. We can make an impact by making sure that we're doing that, right? Versus maybe down the, a secondary goal is to actually, do some of the things that I talked about in terms of reaching out to high schools and grabbing people then and bringing them up instead of waiting for people to already choose a career that's not in human services and then try to convince them to come to our side of the, it's very difficult. And so I think that that's part of where the prioritization has to come into play, right? Where can we have an impact? I mean, I really think that's what we want to do, right? And I think honestly speaking, that oftentimes these committees, we have trouble getting engagement from folks. And thank you guys for being here today, because I know this is a crazy week for a lot of people for a lot of different reasons. But I think they don't see the fruit of their labor and they become discouraged and, feel like we're all busy, we're spending time. So, let's decide on something. Let's prioritize. Let's pick one thing off a list and really focus on it and try to move the needle.
Because I think to do both, it goes beyond the scope of just education and training.
Yeah.
We would need like a partner group that's working on, building. Yeah, exactly.
Yep. So I think bringing it back to the council, and the timing is good. It's in a couple of weeks to say, this is what we've talked about. And, if we are in agreement that we might say that we're gonna, there are a number of service gaps, but we think there are actually, settings, or there are groups of individuals, employees, that we can help to enhance their skills so that we can actually move the needle on X, and then we can prioritize, what might those areas be in order to do that. Tara.
I know one thing that we were talking about, because I do think that it's important to also look at what other people are already doing.
Definitely. We did talk about that.
Yeah, so they're in Public Act 23-137. There was the Office of Workforce Strategy was supposed to look at human services
Yep.
pipeline. So I think there is a draft report that they have submitted, but
Okay.
I don't believe that anything has been finalized. If that's something that you would like me to reach out to them to see what are some of their identified recommendations and strategies that they might be working on, we could at least put that as an agenda item at some point.
I think that would be awesome. I think just having a connection between this group and that group, just saying we can help inform what they're trying to work on, and then they can take their piece and we can try to focus on, what our work is. I think that would be really important. I think we have a lot we could share with them about all of our own collective experience in trying to build a workforce and where the barriers are and how we think that impacts the provision of service or access to service. Okay.
I can see if that's an option for our
Okay.
September meeting.
Okay, excellent. Any other thoughts, next steps? Okay. Well, great. Thank you, guys. I appreciate it. I think we're gaining some momentum. We just have to, I think, narrow our, what our thoughts are so we can try to make some actionable steps. So I think that one of the keys too is, as difficult it is meeting every month, because when you meet quarterly, you're trying to remember what the heck you talked about 3 months ago, and a lot's happened in between. So I think that I appreciate everybody committing the time.
Do we have a date for the next meeting? Because I don't have that written down.
So it's the
Fourth
I
Wednesday.
sent out a reoccurring, but yeah, it's the fourth Wednesday of the month,
Thank you.
or the last Wednesday. So the next one is set for September 25th at 3:00. And then we will, while I have everyone here and we have 5 minutes or 10 minutes, I'm going to use it. So then our October, our October meeting is the 23rd of the month, but then November is the 27th, which is the Wednesday before Thanksgiving. Do we want to keep that or move that? Skip that, bump it? What would you like to do?
I don't think we should keep it. I think we're going to have challenging attendance, but I would leave it to the group whether because where does it put us in December? We might want to
It's
do
the same.
Yeah, so I think maybe we can try to find a time where we can do one for November, December, just because of the holiday time, and then get back on track in January. Does that make sense to people?
So we do have our larger meeting on November 20th, which is the Wednesday before. So we may just want to skip November
Yeah.
and December, and then pick back up January, if that works. Or we could try to meet after or before the council meeting.
Or meet in like early December to kind of split the difference.
Yeah,
of
that's what I was thinking. Just have
Yeah.
one meeting for the 2 months if we can agree on that.
So we could do like December, bump it up a week and do December 18th, that Wednesday.
Yeah, that might work. Maybe we can put that out to folks. I mean, we're never going to get everybody, but we
Right.
have at least gotten pretty decent participation. So,
Okay, so I will cancel the November meeting and bump the December meeting.
okay. All right, great. Anybody else? Thanks, everybody. Have a great rest of the day. Bye-bye.